I want to thank everyone who's been following the clear rules that we set out on Monday, and I want to thank everyone in the NHS, the front line of the fight against coronavirus, and of course, all our public services. Our teachers and our school staff, the transport workers, police officers, everyone who's keeping this country going. But I also want to offer a special thank you to everyone who has now volunteered to help the NHS. When we launched the appeal last night, we hoped to get 250,000 volunteers over a few days. But I can tell you that in just 24 hours, 405,000 people have responded to the call. They will be driving medicines from pharmacies to patients. They'll be bringing patients home from hospital. Very importantly, they'll be making regular phone calls to check on and support people who are staying on their own at home. And they will be absolutely crucial in the fight against this virus. That is already, in one day, as many volunteers as the population of Coventry. And so, to all of you and to all the former NHS staff who are coming back now into the service, I say thank you on behalf of the entire country. We are massively ramping up our testing programs, buying in huge numbers of tests to see whether you've had it already, but also pushing forward very fast on testing people to see whether they currently have it, the antigen or the antibody tests that have been described. And as Matt Hancock, the Health Secretary, has said, we're going up from 5,000 to 10,000 tests per day to 25,000 and so on. Hopefully very soon up to 250,000 a day. But
the thing we would like to do next, which would certainly make a difference, less to the disease, but definitely to the NHS, is being able to test NHS and other critical workers who are self-isolating, who currently are not being tested because we do not have sufficient testing. And this is a global problem because basically every country is wanting this new test, which for a disease that wasn't actually being tested for anywhere three months ago. So everybody wants this. So there is a global shortage, and that's a bottleneck for us. But the next priority is to get critical workers back to work, or to say to them, you have got this. So we definitely would like that, not to fight the disease, but to support the NHS. Once we have more testing than we need for that capacity, then we want to go out to test a much wider range of people with mild symptoms. Some people are already having it as part of our surveillance system, but we would obviously like to go wider.